monorail train station, and Canada is planning increased screening as well.
My goal is that we create internationally as many different checkpoints as possible for travelers who go through the system.
Meanwhile, in New York, 200 workers at LaGuardia's airport walked off the job following ongoing complaints they say include a lack of equipment and training.
The Ebola scare is one of the huge parts of it because the workers are cleaning the planes. They find all sorts of things, needles, vomit, all kinds of stuff.
Well, their employer has a different story, saying just last week employees were briefed on new Ebola protocols. The Port Authority has agreed to review the workers' concerns, and now the workers say they'll return to work. Renee Marsh, CNN, Dulles International Airport.
And passengers on a flight from Philadelphia to the Dominican Republic were stuck on board for 2 hours after they landed because of an Ebola scare. Local media reports a man on the U.S. Airways flight said, quote, I'm quoting here, "I have Ebola, you're all screwed." Obviously, understandably, people were scared. So when it landed in Punta Cana, a hazmat crew boarded the plane to escort the man off. It's not clear if he was arrested. The plane was checked and given clearance. The airline actually apologized for the inconvenience, but said it had to follow strict CDC guidelines. And there's growing criticism in Spain over the case of Teresa Romero Ramos, the first person to contract Ebola outside of West Africa. Now, as I told you a bit earlier, her condition is worsening. Isa Suarez tracks the missteps in her diagnosis and treatment. Here she is.
September was a busy month for Teresa Romero. She had been caring for missionary Manuel Garcia Viejo, but a day after he passed, she decided to take some holiday, staying here in Madrid in her apartment.
3 days later, on the 29th of September, she begins to feel ill and neighbors see a change in her. We saw her and she looked a bit weak, and we thought, this lady's not well, tells me this neighbor. She waits a day and goes to a local doctor. Here she tells her doctor that she's been in contact with an Ebola patient. They take her temperature, but she's given the all clear and told that perhaps it's a minor cold. After all, it's the beginning of the flu season. 2 days later, still feeling ill, she calls the hospital where she worked and cared for the missionaries and informs them that she's still unwell. They send her elsewhere, where she's once again assessed, and once again, she's sent home. According to protocol, someone is considered infected when the body temperature of the professional is higher than 38.6 degrees centigrade. We believe it was a big mistake to send her to a local hospital. We think she should have gone straight to Carlos III Hospital. 4 days later, she begins to feel worse. She calls the emergency services, and an ambulance picks her up and drops her off at Alcorcón Hospital in southern Madrid.
That same ambulance drops her off here, then goes on to transport 7 other patients. But it is only 12 hours later, once they have confirmed that she has Ebola, that they are told to disinfect the ambulance.
Inside the hospital, she is tested, but the response is shockingly slow.
Errors of protocol have only occurred in that doctors and workers treating the patient were not informed quickly enough if the suspected case was positive. We are talking about 2 hours to confirm, and the second problem was the time it took when we asked for patients transfer to Carlos III. There was more than an 8-hour delay.
Healthcare workers and unions tell me this is a stunning series of lapses that have been exacerbated further by poor training, substandard equipment and relaxed procedures, only to be accentuated even further by austerity cuts. They're clearly leaving their mark. Isa Suarez, CNN, Madrid, Spain.
Clearly so many mistakes were made, clearly a steep learning curve for a lot of countries. We'll have more on the Ebola outbreak later on CNN. The family of the first Ebola patient diagnosed in the US says Thomas Eric Duncan's death could have been avoided if he was given the proper medical treatment. And the hospital where he was treated may face an